Welcome, everyone, and thank you so much for joining us today for the panel discussion, Bridging the Gap, Philanthropy's Role in Rural Healthcare. My name is Ashley Roberts, and I'll be your tech host for this session. Before we hand things over to our panel, I wanted to take a moment to cover a few housekeeping items. We'd love to hear from you throughout the session. You could submit a question at any time using the Q&A panel. Look for the Q&A button at the bottom of your screen. We'll be monitoring it throughout and we'll address questions during our Q&A time at the end. The chat window is also open for general comments and conversation. I'll be keeping an eye on both chat and Q&A throughout the webinar. We want you to know that today's webinar is being recorded. A link to the recording, along with a copy of the slides, will be shared with all registered attendees following the event, so don't worry about capturing everything right now. A quick few notes on tech. If you experience any audio or visual issues during the webinar, here are a few things to try. First, try leaving the Zoom meeting and rejoining using the same link. If audio is an issue, check that Zoom has permissions to use your microphone or speaker, or try switching to the audio output in Zoom's audio settings. If you're still having trouble, you can dial in by phone using the phone number provided in your Zoom invitation. That will get you audio right away. You're also always welcome to drop a note in chat, and I'll do my best to assist you in real time. And again, remember that the recording will be available to all attendees, so you won't miss the content even if you experience a disruption. That's everything for me. Now it's my pleasure to introduce the moderator for today's panel, Greta Daniels, Senior Vice President at GOBEL.
Thank you, Ashley. And thank you everyone for joining us today for what I know will be a very rich and important conversation. I'm Greta Daniels, and I'll be your moderator for this afternoon's panel discussion. Rural hospitals are the backbone of hundreds of communities across the country, and yet they operate in some of the most challenging circumstances. Today, we're going to talk about what philanthropy can do and is already doing to create opportunity for these vital organizations. I'm joined by three people who are on the front lines of this work every day. Tricia Huston is the Executive Director of Resource Development at the Guthrie Clinic, where she leads strategic fundraising efforts to advance patient care, innovation, and community health. With nearly 2 decades of experience in philanthropy, including prior leadership roles in higher ed, she brings a strong track record of cultivating donor relationships, securing major gifts, and advancing grant-funded initiatives. Tricia oversees a comprehensive program spanning major and grateful patient giving, grants, foundations support, corporate partnerships, and works closely with leadership to align philanthropy with organizational priorities. Known as a very collaborative, mission-driven person, she's passionate about connecting donors and funders to make a meaningful impact and expanding access to high-quality care in rural communities. Thank you so much for being with us today, Tricia.
Thank you. Looking forward to the discussion.
Ashley Wilson serves as the president of the INTEGRIS Health Foundation, where she leads philanthropic strategy and donor engagement for Oklahoma's largest not-for-profit health system. She stepped into the role in March 2025, bringing deep experience in healthcare fundraising, organizational strategy, and mission-driven leadership. Prior to joining INTEGRIS Health, Ashley served as the Chief Strategy Officer for Ascension Texas Foundations, where she oversaw strategy and shared services for 5 regional foundations, helping raise more than $45 million annually in support of 15 hospitals across the Ascension Texas system. We're so delighted you could join us, Ashley.
Thank you. Happy to be with you today.
And last but not least, Jason Manning is a senior consultant here at GOBEL. His professional experience includes work in alumni relations, board relations, marketing and public relations, operations, special event planning, annual giving, major giving, planned giving, all the giving, and campaign planning, of course. Prior to joining GOBEL, Jason was Director of Development for Clinical Engagement at Albany Medical Center in Albany, New York. Thanks for joining us this afternoon, Jason.
Happy to be here, and as part of my role at GOBEL, but also having the privilege of working with both Ashley and Tricia for years on their shop. So,
absolutely,
what a good discussion.
So, before we get into the meat of our discussion, I want to make sure that we kind of provide a little bit of context for the work that we're talking about, in terms of rural healthcare. So, I want to make sure we have a clear picture of what we're dealing with. So Ashley, I wanted to kind of toss this question over to you. What are the healthcare challenges that are being faced by rural communities, ones that people outside of rural America may not fully appreciate?
Thanks, Greta. To give a little bit more context, I think, to INTEGRIS Health before I jump into the question is While you mentioned we're the largest healthcare system in Oklahoma, that is comprised of 20 hospitals, 6 that are defined definitely as rural hospitals, with many clinics and outpatient, inpatient in all of those communities and urgent care sites as well. And so just to kind of give you a scope of when I talk about rural healthcare, what that means for INTEGRIS Health. And so as far as unique challenges that I don't think some of us always think about if you're in a metro area or more of an urban area is access. I think a lot of the biggest issues revolve around access and what that means, because we can unfortunately not duplicate every service at every one of our sites, right? And for a variety of reasons. And so you have to get creative about what that care looks like, or otherwise you have community members and people all over our state having to drive 100+ miles to receive basic health care. And so, we are responsible especially when we have hospitals that are the only hospital in a city, in a multi-county region, 90-mile radius. We have to think about what that looks like, because we have hospitals that are in maternity deserts. 53%, I think, of Oklahoma counties are considered maternity deserts. So what that means is you have people who are going to opt not to have prenatal care, and that's very dangerous, right? And so thinking about that's just one of many examples I think I could give as far as what that means for us from a rural healthcare perspective. And then obviously the effects of the one big beautiful bill for Oklahoma and specifically for our rural hospitals is going to be very significant. And so we have to think differently about what that looks like. And we're already seeing hospitals close as a result of it in our rural communities. And so that's going to continue to affect our population and the health of our community members.
Absolutely. Yeah, I think that's, as someone who lives in a rural community myself, this hits home as I'm looking at different clinical sites that are struggling. Watching consolidation happening, watching all of the different trends that are playing out kind of right before my eyes in our local community, and thinking about all of the things you just brought up, access being number one, particularly in populations or in areas where we've got aging populations and folks who are trying to see that care long term. So absolutely. And I think this is where I'm interested to know more about how philanthropy kind of plays a role in addressing some of these things. So I wanted to ask you, Jason, because you have a really interesting point of view given your role in consulting, and you work with INTEGRIS and you work with Guthrie and you work with a number of organizations. So you're seeing things kind of at scale and at
Yeah.
scope. What role is philanthropy playing today, or should it be playing, to address these needs in our
Yeah.
rural communities?
Yeah. So philanthropy is not just a nice to have anymore. It's not a bonus, right? It is a bridge often between just stability or just existing and growth. And I think that all hospitals and healthcare systems across this country deal with operating margins, and I don't think that is something that maybe potential donors and friends of the organization really know about. But it's particularly evident in rural communities, right? And for rural hospitals, where operating margins are so tight, right? So that's where philanthropy can help play a significant difference. And I see it really in a few main areas. So one is like funding for capital and capital infrastructure and technology. Certainly things that might be unfundable as far as operations are concerned. So modernizing a 30-year-old emergency department, investing in technology. And Tricia, I know that the Pulse Center is something that is near and dear to the heart of Guthrie, and that technology and that connectivity to people who aren't necessarily close to that healthcare. Recruitment and retention, right? It's extraordinarily difficult to recruit clinicians and physicians and talent to rural areas. So philanthropy are things like, housing stipends, right? So, things like, maybe paying off medical loans, even things like endowed chairs, which can really raise the profile of some of these opportunities that physicians and clinicians are looking for, is really, really important. But I finally think that it's about the social proof of community engagement, and really the idea that when people start investing in healthcare in the community, it's a massive psychological vote of confidence, right? People are saying that this is our local community hospital. This is important to us, here in the area. And my friends, my business partners, my colleagues, my neighbors, all of these different things, they're also investing in this really important pillar of the community. And it's really, really important. And kind of taking those things and positioning the hospital as a worthy philanthropic cause is really, really important, across the vantage point, and positioning philanthropy is instrumental to the success of rural hospitals.
I think you make a really interesting point about that community engagement, that community input, because I think it could probably has two layers. And Tricia, I wanted to kind of toss this one to you because I think there's two pieces to that community input part. There's the community input in terms of what is needed, from a priority standpoint, whether it's the maternity deserts that you referenced, Ashley, in terms of the care, like where the care gaps are within these communities, but also the community input for what people are interested in supporting. So like the donor community, how are they influencing kind of your fundraising work? Tricia, can you speak to a little bit to how, you're taking that input or how this is driving your strategic fundraising at Guthrie?
Yeah, absolutely. Just to give people a little context about Guthrie, we serve predominantly a rural region across northeastern Pennsylvania and upstate central New York, southern New York, covering about 14 county service area that spans more than 10,000 square miles. So we care for patients through 6 different hospital campuses and dozens of outpatient and specialty clinics across the region. But really serve an important role in our communities, that's for sure. In terms of some of those needs you were talking about, Greta, obviously in many rural populations, I don't think our region is necessarily unique to this. We have a lot of there's an aging population there, right? And so sometimes these folks are sicker and have more needs related to that. So a lot of it's the chronic disease management. Sometimes we have lower socioeconomic needs and resources. Some of the key top areas that we hear about a lot are mental and behavioral health, access to primary care, like Ashley was saying, making sure that people have access to some of these services in their communities, but also balancing that with what you're able to provide across your health system. And then maternal health, obviously, is something that we too deal with in a rural community. So, for example, one of the recent reports, we were serving 2 of the 5 community deserts in Pennsylvania. And so, how do you combat that? How do you help with that? And on the New York State side, actually, we were able to secure a grant through the Mother Cabrini Health Foundation to launch a mobile unit related to giving maternity care across the more rural areas of New York. And that has been a wonderful service to provide out in some of these communities where transportation is challenging. They can't get to these appointments, so they forgo these appointments. And so now we're bringing the care to them so that they're able to get what they need in their community. Looking at the slide that you have there, Greta, I think a lot of our funding is in line with most of these. A lot of folks want to support capital and facility improvements. It's something tangible that they can see. Telehealth and infrastructure, as Jason said, we have a wonderful program called the Pulse Center, which is kind of our centralized hub that allows us to track all activity across our health system and involves a lot of technology. But in these rural communities, we're struggling with broadband access, right? And you don't have cell phone service to fall back on. So if you don't have broadband, you don't have cell phone, you can't utilize the technology that's available. And so it's really important for us to be working with our local partners and helping, encourage the investment in broadband across our communities and doing what we can to help educate our patients on how to use the technology, because then you have some of that lack of knowledge about how to use the technology because it hasn't been in place. And so those are some of the things that come to mind quickly. But yeah, definitely opportunities to support what's happening.
Yeah, I was thinking about the broadband issue because I also live in Pennsylvania, just the opposite corner of
Mhm.
Pennsylvania from where Tricia is. So, and given that this is a very large state that people underestimate how big it is, we're about 7 hours away from each other. But yeah, I think the broadband issue is one that's pervasive in rural communities across the country. And while the technology, like the capability might exist, it's the actual affecting of that solution can sometimes be a bit more of a barrier than you realize because of the infrastructural, deficiencies on a community level and a state level and a government level. So I think there's, those are things that, one hospital or one health system can't solve for, across the broader. So how we work and partner with those broader organizations is super important. So kind of that it's a good segue to kind of talk about barriers. I think we're all, as fundraisers, we're all inherent optimists. We absolutely see opportunity to solve problems and to connect people together and find ways to work together to better our broader communities. But there are real barriers and there are real challenges, and it forces us all to prioritize and to pick our battles, so to speak, and figure out how we're gonna work today. I'll start with you, Ashley. Like, from your perspective, what are the barriers that exist when it comes to directing philanthropic, support to rural communities? Like what's preventing people from either giving more or preventing you from raising more at this point?
I think it's a variety of things, and it's not a lot of difference between rural and urban philanthropic kind of needs and barriers across the board, but it is uniquely different, and it's not one size fits all. I think each community is very different in what is needed there, and you have to have those relationships with your hospital leaders, your clinical leaders, and then the relationships with the community members in these rural communities, and listening to them and what they think the needs are. But then there's always going to be a balance of there's way more need than we're not going to be able to support it all, right? And so being very thoughtful and strategic with them about what the priorities are and where philanthropy can have the most impact, right? Or how we can get creative in resourcing it by talking about telehealth and other, one of the great benefits of being part of a larger system is that hub and spoke model. So like, how can we be creative in how we resource for things when we can't hire that oncologist in that rural community, or we can't hire that OBGYN? We've gotten creative about, we've recently hired 2 midwives in our rural communities, and that's had a huge impact there, right? And then thinking about how we resource that differently, and how then philanthropy can come alongside our leaders and help drive what that strategy is, and being creative in how we look for those funding opportunities, and being really aligned with our donors about how they can have an impact alongside that. But there are lots of needs, and like we talked about, the margins are different, and it's not one size fits all. And so when you think about all those barriers, I think you have to be very creative in how you solve for that, and very relational, just like in all of our work, right?
Yeah.
Yeah.
And Ashley, I would offer too, and I know this both of you and your organization, and Tricia's as well. This is not necessarily the case for you, but it's a top-down, inside-out type of barrier and then approach, right? So it's like not just understanding what those funding priorities are, but it's engaging leadership, right, in the identification of them, and then also, marking them or linking them, outwardly, and communicating them to the community. If we need leadership involved in this, and if they're not, if philanthropy is not a part of the strategic plan of the organization, it stays sidelined, right? It's not something that is particularly important. We need a leadership team that is trained, that's willing to participate in donor engagement, willing to identify those funding priorities. And without that, a lot of those directions don't happen. So really leaning into leadership on the administrative side, but also on the clinician side, right? In rural communities, clinicians the burnout is a real thing, right? And they're wearing 10 hats, and they might not have time on their calendar for one more thing. But the identification of grateful patients and families to articulate these funding priorities to and the needs for them, extraordinarily important, right? Finding those strategic partners who are in key service lines, who are part of what needs to be funded to advance the mission, vision, and values of the organization is important, because those clinicians are the link to the grateful patient, right? Those grateful patients, the gratitude is manifested because of the extraordinary and compassionate care that exists. So we need those clinicians to help us to find those grateful patients, to articulate those funding priorities, right? So it's this kind of, it's the circle that is going on. And then it's the philanthropy shop, which, we need them to have a major and principal gift strategy, right? We need to kind of move beyond just small annual appeals or, things in rural communities that we might lean on a little bit in philanthropy, like, transactional, special events perhaps, or other smaller types of swings. Looking at those bigger swings and finding those grateful patients and families who understand the importance of the hospital as a pillar of the community, so extraordinarily important. And that can really be a barrier in a rural health community. It's not from a lack of gratitude, right? It's not from a lack of generosity in a rural community. It's communicating the why behind how healthcare philanthropy makes such a difference.
Mhm. I think too, just looking at the slides that you have here, Greta, funder preference, starting with that too. We need champions of rural health. We need people out there that say, I want to help these communities just as much as I want to help some of these urban communities. A lot of our young folks move away, right? They come, they learn here, they grow here, and then they leave us. And so making sure that we're finding ways for them to plug back into the community and to support the important work happening here. And I think also the other thing is, visibility gap, but also in these rural communities, a lot of times these hospitals are the largest employer, right? And so our community doesn't necessarily see us as a nonprofit or needy or what that might look like. But it's so critical that we have investments in our health system. We can't survive. We can't sustain operations without that support. And so I think the more we can tap into that and tell the message of why we're here, what does it mean to be a nonprofit health system, how we're giving back to the community and making sure we're sharing that. Because as people see hospitals close around them, like this support is what will help us sustain. So,
And I think to your point, Tricia, I would just add that I think reminding them oftentimes too that a lot of these hospitals were built by these communities through philanthropy. We have so many hospitals that is the community came together, they pulled their resources and they built that hospital. And while that is not the exact scenario we're in today, it still requires that to maintain it and to be that pillar that is needed in the community.
Yep. And I would say that, while typically, a typical, ratio or percentage, but 80% of philanthropy comes from individuals. That's kind of a best practice mark. It's corporations, right? It's local companies as well. I mean, Tricia, I know working with you, I would say in the Cortland community, they do such an extraordinary job of engaging with small businesses, right? Small, not just necessarily big companies, but small businesses, right? The ones that, they're many of their employees get their health care at the institution, right? And and they want to make sure that it's tip-top care. So engaging those companies, and not just the corporations, but the ones that are backbone of rural America too, is so extraordinarily important, and making sure we're spending time on them as well.
yeah, it's a partnership. We can't be there without them and vice versa. So it's really important.
What is staffing for you both like in your environments today from a philanthropic point of view, finding like, recruiting, identifying, retaining strong fundraising talent? Has this been a challenge in your current environment and previous environments? And if so, like how are you solving for that?
I can start. I think, we've had a great team here in place at Guthrie. We're really lucky. We have great retention on our team currently. But anytime we've had to replace someone, it is a challenge because there isn't kind of built-in fundraising talent locally. There could be, but we're not, it's not higher ed where you have these shops that are 150 people strong. We're a small but mighty team. I think in total we have about 10 people. And so we're doing the best we can, but we cover such a large footprint that making sure you're devoting enough attention to each of those, service areas is really challenging on a small staff. The numbers aren't there to warrant growing FTEs. But in order to really do this work well, it's so personalized and it's very relationship oriented that you have to be able to have teams that you can deploy to these communities and really draw people in and share your message in a meaningful way. And that's hard to do on with a very small team.
What about you, Ashley? Have you had difficulty with staffing, or has that been something that you've dialed in at this point?
Well, I'm a little over a year in, so I'm I'm a little newer into this role, but I think we do have a good team. We are small but mighty too, and we are not focused in, we don't have fundraisers in each of the communities we serve, right? But to Tricia's point, we're having to deploy them. I was in Miami and Grove yesterday, drove 6 hours in one day. And so, it's making sure we're being thoughtful and strategic about when we go, how we go, and what that looks like, and having advocates on the ground, what I call our boots on the ground in those communities. We have foundation councils that serve in many of our communities that are our advocates that can be an extension of us, right? And they under their prime focus is fundraising and foundation work and advocacy. And so I think that model has really helped them, making sure they have a main point of contact at the foundation, but then that's out and knows that community, working with those hospital leaders, right? And understanding the needs specific to those communities. And I am working with those hospital leaders as well. And then we're having those councils that the right people in the right places that are having the communication, building relationships on behalf of us too, has helped to make our reach go further. And especially when you're in a smaller team that's centralized, but deploying in the communities as needed.
Yeah, actually, I know that you've spent the better part of your first year on a road show throughout Oklahoma, which is where INTEGRIS, serves the whole state, and that hub and spoke model, right? And I think that you've done an extraordinary job modeling that to your team, as far as kind of building that street cred with these rural communities, these small communities who want to make sure that they have the attention, of your shop, but also the real importance of understanding that philanthropy that's raised locally stays locally, right? And I think that there's nothing that can tell that story more than not just saying it, but the actions beyond having a physical presence there. Visibility and really that presence goes so far as to really just not saying we're doing it, but showing that we're doing it. And I think that, and I just always like to point that out, that I know you've been on the road a lot the first year. It's top-down approach, right? That's the way leadership works. So I think that's really important, model in which you can talk to others about, for sure.
Yeah, I wanted to circle back. We had a question in the chat that I thought would be helpful because you had both mentioned small but mighty teams. I'm wondering if you could both give a little bit of background on kind of the number of folks that you have on your team, but and what you're raising today is giving people some context on kind of what the team's working on and what your goals look like for the year. Tricia, I'll start with you.
Yeah, as I mentioned, we have about 10 staff members on our team. We're actually a centralized department of the health system, so we're not a standalone foundation, but we do work closely with our other two hospital foundations. One is part of our department, the other one is a standalone foundation, and we do work collaboratively with them. Annually, just with the centralized office, I believe we are raising somewhere around 15 million in cash coming in each year. And then we're also in the middle of a campaign that Jason is helping us with, our Here for Good campaign. And so we're closing in on 47 million on our $50 million goal for that comprehensive campaign. And I think those are all the things that you had asked. But.
Very exciting. Ashley, how about you?
Yes, so we are in a bit of a different phase. We are not in campaign, and we are in a rebuilding phase right now. At the height of campaign, we're probably raising anywhere from $10 to $15 million annually. Right now, this year we'll close in closer to $5 million annually, with hopes of growing that substantially in the years to come. But in the phase of kind of rebuilding and restructuring, so really focusing on rebuilding we're building from the ground a grateful patient program, and then also building towards a comprehensive campaign as well.
Yep.
Awesome. That's helpful. I want to pivot back to something that we started to kind of go down the road on when we talk about outreach and messaging, storytelling. We're thinking about donors and volunteers. I mean, Ashley, you had talked a little bit about your councils and like you're essentially like you have an army of storytellers and an army of champions and people who are, have drunk the Kool-Aid to a certain degree and are helping to tell that story. I'd love to hear from both of you kind of how you're using both volunteers and donors to help as evangelists in the space, but what you have found to really resonate with this very specific story for this rural care. Tricia, I'll start with you.
Yeah, I think First, I love Ashley's regional council model, so I'm going to be talking to her about that after the webinar, but I do want to learn more about that. I think those local volunteers are so important, and we see that in our service areas that have foundations. You know, they have that built-in group of folks that are from that local community that care about their local hospital, and they're out there, you know, singing our praises and sharing those stories with the community. In the central area, we don't have like a development council or anything like that, something that we need to get in place. But we need those advocates out there sharing our stories in these communities, talking about the important role that the hospital plays in their own community. But also, a lot of our caregivers are from these communities. So they live there, their friends and family get their care there. And so one thing that has really helped us too is our caregivers, you know, not just our physicians, those folks are helpful as well, but all of our caregivers. And so one initiative that we launched this past fall was around bringing contrast enhanced mammography to one of our critical access hospitals. It's a very high level service that we probably wouldn't be able to provide, but one of our caregivers in that space was like, we need this for our community. More and more women are getting diagnosed at a younger age. This is so important. If I can help you raise the funds, can we bring this technology here? And so our leadership team let us do this. They let us rally the troops in our community, and it was phenomenal. It was one of the best fundraising activities I was ever part of, because every aspect of the community, the schools, the businesses, the local radio station did a radiothon for us. I mean, it was incredible to hear these stories out in the community, how we're impacting care, how we're caring for these people in the community that we wouldn't have otherwise known, you know. And so I think it really changed people's perspective of how they can support our local hospitals, and it was really powerful. So I think lean on those caregivers. If they're passionate about something and it's something that the institution also wants to move forward, lean into that.
And what I liked about that, Tricia, was and kind of witnessing it from you all is, resource development. Your office was was the professional organizer of this, right? So you had the why and the how of how this is done in a best practice type of way, but you were able to deputize these people individually, and they really became an expansion of your team. And you actually kind of ran it almost like a mini campaign where you bring these volunteers together. They would check in on who their assigned prospects were, and they personally took a vested interest in the success of this, which was why it was so successful in such a short period of time, simply because it was so community minded, it was so volunteer driven, but it had that professional infrastructure that you were able to monitor while also allowing people to do this, so you could spend your limited time, on other projects throughout the system as well.
Ashley, have you thought, when you think about philanthropic outreach and messaging and volunteers, I mean, your regional counselors are really cool. I'm sure you're going to be getting a lot of questions about this from folks on the webinar later, and how you work on that, how you're given just the breadth of the state and what you're trying to manage from in that hub and spoke model. What really is working for you in the outreach, the messaging, the storytelling? What resonates for the INTEGRIS community?
I think it's a few different things. I'd echo what Tricia said about caregivers and our, they're the 12,000 plus of us here in the state, and them telling the stories and advocating for philanthropy is so huge, right? Understanding philanthropy's role in our hospital system. And so we have a very, what I believe is a very successful employee giving or caregiver giving campaign that we do annually. We're actually just coming off of that, ending last week, and raising a little over $835,000 across, over 3,000 caregivers. And each one through that program, we have very site specific in every one of the rural communities, site specific projects that those caregivers determine what that funding will go to that year and what it will support. And I think that's been a really great tool for us to understand what they're rallying around and what they personally want to invest in. And then being able to tell the impact of that. These are projects that have to be completed in the next 18 months that they want to fund, they think is a need, and it resonates that way. And so I think we've learned a ton through that. Now it's complicated. When I started, there were 28 passions across the organization for our caregiver giving campaign. We have 21 this year, so that's progress. But they've been able to be very specific about that, and I think that's really resonated and allowed us to have those advocates in them and understanding the impact of philanthropy and being able to talk about that at the bedside, right? Like very personally talk about that. And so I think that's one aspect of it. And then I think Jason alluded to kind of this education roadshow that I've been on. And that started with our leaders. That started with our executive leaders, then our hospital leaders, physician leaders. That's where that kind of conversation started, and making sure they understood the role of our foundation and the impact that philanthropy has had in this system, and then making that very real and telling stories to their region. And all of the hospital boards, same thing. That's the hospital boards and our councils, and giving those presentations across the state for the past year, but dialing that in and giving very real examples of, for example, we, in one of our rural communities, we were very fortunate to receive a $1.8 million estate gift, anonymous estate gift from a woman that had worked for the city for 30 years. No one knew she had any type of philanthropic giving or capacity. And she gave 100% of her estate to the hospital because she was thankful for the care that she received and that she wanted that care to remain in that community. And she knew how important that was. And so just telling stories like that in our rural communities, that that's possible, I think has continued to evolve that conversation, saying, well, why can't we do that? Right? Because they can, and it's happening, and they've got to continue to kind of tell our community members they can be investing in their healthcare and what that looks like, and that they're needed in order for it to stay in our communities. And so I think her gift was just one of many, but it's one that will have transformative impact in that rural community.
Yeah, I think that's really,
sorry,
really interesting. No, I was just going to say, like, the planned giving piece, really, like we had talked about this earlier, where I was really, I mean, that's like getting that anonymous, unexpected, estate gift is certainly, what a thing to really celebrate, and what a reflection of the impact that that INTEGRIS is already having. Like, I feel like for you, it's more of like a verification of what you already know to be true. Like, we are doing this work, and the philanthropists are out there. We just need to connect them with the work that we do, the mission that we are achieving on a regular basis. And we can be more thoughtful and intentional about all of those things. But I thought it was interesting. You had mentioned it, and I just think it's interesting to see that planned giving is becoming more of an influence in rural healthcare and rural healthcare philanthropy today too. So I thought it's absolutely something that has like been buzzing in my brain since we last talked about. I was like, we need to think more about estate planning, and how do we get the resources for this out into in the environment as well. Jason, what were you?
No, I'm just gonna continue what you had to say there. I totally agree with that on planned giving, and I think that it's the idea of being able to be able to articulate giving from assets versus maybe giving from your checkbook, right? And while of course we want to we want to encourage both of those things, if patients or rural members of the community, they might not be able to feel that they might be able to make an impact that they could with outright giving, being able to articulate how giving from assets or how leaving a bequest or giving in that manner through those vehicles, can have significant impact, and how that brings you so much closer to the mission of the organization. And we can steward you and make you feel great during your lifetime, and you don't have to necessarily wait until after. Is a really important asset and a really important resource to invest in across all markets, but particularly in rural markets. And just really quickly, Ashley's You and I employee campaign is a best-in-class campaign. It obviously raises a lot of money for the organization. It helps with to develop and lean into these passions. But what I like a lot about that too, and Ashley, I have had this conversation, is it's not just the dollars that are raised, but thinking about the impact that philanthropy can have on employee engagement, and then by extension, patient satisfaction. That is the compounding effect of a really great, philanthropy campaign, and how it resonates beyond just the power of the dollars that are raised.
Yeah, Ashley, I'd love for you to share a little bit about the employee giving campaign, because it is something that I think is unique. And so many of the folks on this webinar will probably perk up and listen to, because this is an actionable thing you can do today to drive the needle. In terms of like, you've got a constituency that's right in front of you. You don't even have to go find them. You know who they are. Would love to hear a little bit more about this campaign, how it was built, and what makes it sing, like what's really driving it.
Well, I think it's a team that has done it and honed it over time, right? Like I will not act like I came in here a year ago and created this. This is something that is started in 2012 and has raised over $10 million for this organization. And it was done, it's honed in over time, but it's been, it's resource intensive, right? We're in the hospitals. We're putting up materials in every hospital. We're shipping, we're doing, people love a t-shirt Friday. I don't know about your organizations, but ours love being able to wear that t-shirt, and we get executive leadership to give us those 6 t-shirt Fridays that they can only wear their UNI t-shirt if they've given. And those carry weight, right? And then I think, it's not all about the tchotchkes, but I think it's like them investing in, like I said earlier, having a say-so in what their project will impact has a huge, I think, engagement opportunity tool for them, right? And saying what that's going to look like, and leadership, hearing that, letting them speak into that and coming to that resolution. Then, also talking about really looking at the data and looking at where do our caregivers want to give. Something we tried this year for the first time is we've never had an area of greatest need fund, which I know sounds like, why would you not? Like, of course, right? As fundraisers here, but it was something that we've been so specific about what we refer to as passions that thinking about cancer and mental health and heart care and all the pediatrics, right? All the key ones, but thinking, okay, let's see what happens. It was one of our top 3 passions this year. And so that told us a lot, right? About that some people they're passionate about it all and they want it to go to wherever we need it to go to, right? And so we're learning a lot as we dig into it, but it's a little over a month-long campaign. We actually also engaged our board members for the first time this year.
Wow.
And so that was to see over 40% of our board members engaged. We raised over $50,000 just from board members alone. And so that's a huge, I think, movement for what Jason was referring to, that top-down culture and being able to tell that story to our caregivers. And so there's things like that we're still honing, right? Like, you got to always think and question and see what we can try new about that. But it's a great campaign that changes each year a little bit, but is across the system. I think the visibility we have in it across the system, it's on, when you open into the intranet, it's right there. It's the first thing that you see. We're going to send emails every single day. You're going to see us have booths in every hospital. You're going to see the posters everywhere. We're going to have champions that are leaders on the ground at each site, right? Talking about that. We're going to have the hospital presidents sending emails. We're going to do all of those things. But it is one of those things that we have honed in over time. And I think that I'm really proud of the team and the work that's been done. And it really is just a very successful campaign that, to Jason's point, has this ripple effect in employee satisfaction, in a culture, in just engagement in general. And the stories we hear tell that too. And so we are very specific to, after this campaign closes out, is we will tell impact stories to each one of these donors with each one of these passions. And so closing that loop and making sure we're not just telling them at the get-go what they can invest in, but closing the loop and coming back and saying, this is what your impact did. This is the lives that were affected. This is the patient impact, right? And so that, I think, is a key part of us stewarding them year after year, is they really do see that impact, not only in their hospital at the bedside and what they're doing, but we're telling those stories in a very real way to them after the campaign ends. It's really a year-long stewardship process with those caregivers.
Yeah, I hear, like, when you're talking about this, I'm hearing things about, culture change, from top down, or culture reinforcement, perhaps, as inclusive approach. We're talking about storytelling. We're talking about impact. And about, I go back to the beginning of our conversation. We say, like, some of the biggest challenges that we're facing. We talk about employee burnout and talent shortages and droughts and kind of like shallow pools when it comes to the talent space, and how important it is to retain your caregivers and your fundraisers and everybody in house. Anything that we can do to reinforce, that A, we're all on the same team. B, we're doing really good work. Yeah, it's hard, but we're winning. We're having great impact is going to have that positive effect. And it does trickle down, right? It's so interesting to see that, this has an impact on patient care because, you've got people are more positive, more bought in. I think that's just so fabulous. I wanted to share a comment that was shared in the chat from Jacob. He said storytelling is great for content, but it's also about building a process for engaging physicians, nurses, and care teams to recognize special moments, capture them, and connect them into a broader philanthropic strategy. That process creates an awareness to the care team's role in philanthropy. Like it's which I feel like is just what we're talking about here. Like it is, and I always been in this business 20 years, fundraising, and we all use the phrase culture of philanthropy all the time. And some people know what that means, and some people don't know what that means. And I feel like that's what we're really talking about here is how do you create that culture of philanthropy that helps to, be your shield against all of the challenges that we face in the environment too.
And then when we approach physicians and clinicians to be active partners in referring their patients and families, right, to philanthropy, for us to be able to explore their gratitude on their behalf, right, and perhaps, convert them into prospects and donors to the organization, even on the major and principal gift level. It all starts in a lot of this kind of this cultivation of this of philanthropy, of gratitude at the organization to bubble up to for physicians to become champions of philanthropy for sure.
I feel like in every conversation we have to talk about measurement because all the good feelings aside, every single one of us is getting measured on a regular basis, and we have real goals, and those goals have real implications, for the care in our communities and for what we can actually do in the hospitals themselves. So it's important that we're successful. So I'm always curious to know what people are measuring, what, maybe what you're being measured on, but also what are the metrics that are most important to you from an operational point of view or from a management point of view or whatever that might look like. Like, how do you define success? I want to hear from all three of you, but Ashley, I'll start with you.
I think it's, when you're looking at outcomes and metrics, we're all looking at what I refer to as the top three for me, is what are we impacting? What dollars are we granting into the system every year? Like, what is the impact of those and how are we telling those stories? Like the philanthropic impact every single year, what does that look like across our sites and service lines? Like, so that it's very real and tangible that what they're seeing. So talking about that from a dollars granted standpoint, the cost to raise that dollar, right? Are we doing that in the best way? Right? Are those funds that we're raising, are we being good stewards of those? And what does that look like? And then obviously that fundraising total is key. Those are the top three, but we all know there's so much that affects all of those, and those can't be the only ones, right? But because all the metrics and the data that we have to look at that affects those, what meaningful interactions are we having? What ally engagement, meetings and donor meetings and all those things are we having? But looking at that to this slide, the donor retention and acquisition rate, how are we engaging patients? How are we then when they have donated to us, how are we keeping them? How are we stewarding them? How are we being thoughtful about what that looks like? And it's way easier to keep them than it is to get a new one, right? And so how are we being thoughtful about that? And so I do think we're looking at a lot of that data, but you have to roll that up, and you have to make sure that the team, I think, understands how their role specifically rolls up into the larger goals for the organization, and making sure that the organization has philanthropy dollars and their key strategic goals as well. And so we're making sure now that that the executive leadership team and from the top down are looking at those philanthropic dollars too as something we all play a role in, and that we all need to be looking at, because it's going to be more important than ever with the changes that are coming.
Absolutely. Yeah, Tristan, what about you? How do you define success or measure success? What are the numbers that are tattooed on the inside of your eyelids at the end of the day?
Yes, well, obviously, a lot of ours are very similar to Ashley's. Not a lot of change there, but our campaign is top of mind, obviously. So we're always looking at that metric in addition to just our annual yield. But one thing that's really important, regardless of what metrics that you're using, I think is the data visualization. How are you telling the story about these metrics? How are you sharing that with your leadership team in a way that's understandable and digestible, and they can grasp it and understand how we're doing? And, I'm really blessed. We have a great team member here at Guthrie, Jen Warner, who does these beautiful dashboards for us that allow us to showcase the work that we're doing. It's great if you're doing really great work in your department, but nobody sees it, nobody understands it, and you can't really fully tell the full story of philanthropy and how the impact that it's having on the health system. And so that is really crucial for us and has been a game changer. Really helped, I think, to elevate philanthropy in the organization because people can speak to it and directly see the tie as to how we're impacting care at the hospitals.
I think that's a really good call out that, you could have all the measures in the world, but if you can't communicate what you're actually doing, if you can't show it in some sort of visualization or some sort of narrative, that you could be setting yourself up for even greater difficulty if your leadership can't understand, Ashley, I liked your cost to raise a dollar, especially when we're trying to oftentimes we are explaining philanthropy to leadership teams that really don't understand the business and are trying to equate it to a world that they live in. It could be a for-profit world. It could be could be investment banking. It could be any number of industries that they're trying to create parallels. So when we can create metrics and visualizations that help them to wrap their heads around it, where we can show the ROI, we can show the impact, we can explain, even though we know that fundraising is often a much longer return on investment as we build relationships and really drive the pipeline. You're still able to show it. You can still extrapolate that data. And I think I've seen that, and I don't know, Jason, if you have too, where organizations stumble because they can't
Yeah.
show the work. They can't project, they can't create that sense of potential within their data.
Yeah. I mean, think about the people who we're working with, right? And the people who we need to buy into this, right? It's hospital administration and it's physicians and clinicians. They work in data all day, every day, right? We have to match that, right? And we have to be able to show them that the work that we're doing is also data driven. We are also beholden to metrics, right? And that drives our decision making, right? And it drives our success. So, when I think about it, it's, operational and fundraising efficiency, right? It's cost to raise a dollar, it's ROI, it's production, and it's attainment, right? Those are the ones that we always talk about. But there's quantitative impact, right? And then there's also qualitative impact, right? And I think that in a rural community for a rural hospital, we absolutely have those quantitative impacts, but we could also talk about qualitative impact, right? We can say because of this donor-funded initiative or because of this philanthropy, these 400 families didn't have to drive 500 miles to go get their oncology treatment, right? They could get it right here in our community, and philanthropy played a role in that. So we want to be able to talk about that while at the same time being able to show a really awesome dashboard to our CEO that says, here's where we are against our campaign goal or whatever it might be. So having those two things and realizing the people who we need live in this data every day, and we need to make sure that they know that we do too.
Absolutely. I always joke about this with colleagues that have been in the business a long time as well, where we say, like, back in the day when we all first started, fundraising wasn't necessarily seen as a profession. It was a lot of us kind of came into this from very few of us have like degrees in fundraising. All came into it from different things. One of my favorite exercises with team building is always to ask what your major was in college, because that's always an interesting outcome when you put a bunch of fundraisers in a room. But as we have become more professionalized as fundraisers, we have professional organizations and degree programs and all the things that come with our work. I think it's also about educating our colleagues about the professional nature of our work and building that trust internally where we're driving those strategies and getting their buy-in too. So as we're kind of coming up to the end of our time here, I know I wanted to make sure we had some time for some audience Q&A, and I have a question that I've been holding from the audience that I think would be a really interesting one for our panelists to weigh in on. I have a question about patient acquisition. So how are you approaching patient acquisition work with multiple hospitals across your service area, suburban hospital versus multi-county serving hospital versus outpatient clinic? Is it physician driven? Is it traditional direct mail, email? I'm sure like patient donor or, the annual giving acquisition. How is annual giving being driven at each of your institutions right now? How are you acquiring, given your very different structures and how many communities you might be touching? Who wants to dive in?
I'll say I can start. So patient acquisition is, unfortunately, we had a stop in our patient data coming over into Research Point for quite some time. I'm going to go with years. And so we've had patient data coming back into Research Point for about 9 months now. So making sure we're utilizing that data is step one, right? And so taking that and we did have ad hoc lists that we were getting and utilizing for direct mail, for email, for outreach, I will say. And so we had a direct mail program. We've evolved that over time. We're even taking a harder look at that now, and digital, I would say the same as well. And so thinking about what a welcome series looks like, what a re-engagement series, a lapsed donor series looks like, thinking about it in a lot of different paths and social media on top of that. Little things like making sure there's a donate button on integrishealth.org, which just got added about 3 months ago. So those are the things where it's a multi-pronged strategy. It's not perfect. There's low-lying fruit for us, I would say, that we can do a better job at. But then from the grateful patient side, like taking those physician lists, having 2 physicians that we already have good relationships with, talking to them about what that looks like, building out that program. I've been working since I got here to get an Epic integration added for the referral to Grateful Patient. It will go live May 6th. So that to me is a big accomplishment, right? And so those are all pipeline effectors, right, that are huge for us, that are going to, but there's no silver bullet, right? Like there's no one thing that's going to give us everything, right? But I will tell you, I got asked this question not long ago, is like, are we looking at buying lists anywhere? I was like, until we're talking to all of our patients, we have no need to buy a list. So that's where we've got to start, is making sure that we're talking to all of our patients, so they understand that we are a nonprofit healthcare system, that they can invest in us, right? Those kind of things. And so that's what we're building now, that I think we have a ton of opportunity for. And we know people are getting really great healthcare. We know that we're seeing those ratings, making sure we're taking those into effect too. And with those physicians that are good champions of us too. And so taking all those into account will help us get there as far as from an acquisition standpoint. But I'd love to say we got it all figured out, but we're definitely still flying the plane and building it at the same time.
But I would say, Greta, that really quickly, the question is the right one. Patient acquisition, patient engagement, that's where it is, right? It's like, alumni are to the university as patients are to the hospital or health system, right? That's where it is. Colleges could ask anybody for money. They ask their alumni, right? That's where we want to live in healthcare philanthropy. And the different channels, right? The different channels are the way that all the grateful patients in the world find their way into your philanthropy shop. Clinician engagement, an extraordinary part of it too, at a kind of a micro level, and then obviously acquisition through direct mail and other avenues is on a macro level is the way to do it. But focusing in on the patients, they're the ones who are grateful to the people and the organization for providing them with that extraordinary compassionate care, and that's where we lean into.
Absolutely. Well, just as we have 1 minute left, I wanted to make sure I give first say thank you to our panelists for sharing their expertise and their on-the-ground experience and their wisdom with the panel today, with the audience today. We know that rural hospitals are more than healthcare. They are community bastions. They are the pillars of, so many of our communities. They're anchors to our community life. So I think the philanthropy that we're talking about has such a meaningful role to play in keeping them strong. I want to give each of our panelists, basically an opportunity for a quick closing thought. Anything that you have that you feel like you just wanted to make sure that this audience had before you left. So, Tricia, I'll start with you, your closing thought.
I think it's that philanthropy is, as Jason said, it's no longer a nice to have, it's a need to have. And so if someone hasn't told you today, the work that you are doing is noble work and needed work. These rural communities need philanthropy and they need that to bring care close to home. And so the work that you're doing is so important. So go forth and continue to prosper with that.
Absolutely. Ashley.
I couldn't agree more with what Tricia said. It's work that we are privileged to do. And it's work that we, I'm not a doctor, I can't by any means, but knowing that we can have an impact on the healthcare of our community and that our donors can invest in the future of healthcare of their families and their communities is what it's all about. We're not doing this for us. We're doing this for the betterment of our community, and it's work we are privileged to do and stories that we get to tell of the impact that can make and how it can really change and save lives is just really what keeps us going, I think, on a daily basis and what you have to come back to when you're in the throes of it all. But it's really important work that we are honored to do.
Excellent. How about you, Jason?
Yeah, I'll just use my time here, Greta, just to say, GOBEL is privileged to work with lots of healthcare organizations across this country. And it's a privilege to work with Ashley and Tricia every day and the wonderful work that they do. Rural healthcare is at a crossroads, right? And philanthropy is a big part of it, right? And a part of it moving forward in this country. It has to happen. We have to fight those battles. And I think that, when you are talking to your donors or you're talking to your prospects about philanthropic support, it's about the hospital. Yes, it's about that piece of equipment or about that project, but it's also supporting a real pillar of the community and how that can have an exponential effect on the strength of their buy-in with their personal donation.
Couldn't agree more. Thank you, the three of you, for spending time with us today. For everyone on the call, thank you for spending time with us today. I hope today has given you both inspiration and some practical next steps, some ideas for what you can do next. We are here to be a resource to you, so please do feel free to reach out to us here at GOBEL. We want to make sure that we're helping everyone in this as we're at this crossroads and figuring out what our next steps are going to be on the path forward. Thanks, everybody. Have a great rest of your day.
Thank you.
Thank you.